Nuestra próxima ponente.
Anne is R&D project manager for the wearable healthcare system at Maastricht University in the Netherlands and Maastricht Instruments. With a PhD in cardiac rehabilitation and an active role in community physical activity training. As an expert in adapted physical activity, while working in technical development in Maastricht, and aims to represent the user and or clinical point of view. Thank you very much, Anne, for being here with us this morning. And we are waiting your speech about monitoring of physical activity for hospitalized patients and the elderly, design and experiences.
Good morning to everybody. I hope you can hear me. You can also see. Thank you so much for this extensive introduction. It was my first point in the program. Keep it short. My background is indeed adaptive physical activity, so I'm training people with chronic diseases. But at this moment, I'm in a great team of research engineers working on wearable sensors. In another project, I'm also involved in health data and sharing health data all around Europe. As you can picture in the middle, I'm still involved in physical training for some hours. The age is from 4 years old to 85 years old. So I'm not only elderly, but I do have some experience. I want to show you the difference of Maastricht University and Maastricht Instruments very briefly, and then we go to the technical development. Okay, in Maastricht Instruments, there are many very bright people working, and sometimes they come to us with a very good idea or a question. They want to have a tool that can measure something or monitor something. Then our great team of engineers goes to work and they build it from the concept to the field test model. And when we are in the stage of the field test model, Maastricht Instruments comes in, they do the vision, and then they go for the first market to the hospital. After that, an upscaling needs to happen. It is not there yet for some products, but for others, there are companies taking over and bringing it to the broad market. Maastricht Instruments is a FARA-owned partner, but many of the things that I will be talking about today comes from the Maastricht University phase. Okay, let's proceed. Loneliness has been touched many times before in this meeting, and we all agree that it's a very relevant topic to consider when working with the elderly. I did some research, and the things that I will say here in this slide all come from the systematic review from Pels and Kleinert. And indeed, they say that they found that there is a relationship between physical activity and loneliness and social isolation, and it is a negative relationship. This means that if there are people with very, very low levels of physical activity, the chances are high that they will score high on loneliness and social isolation. And the other way around is also true. So people with very high score on loneliness and social isolation have higher chances of being or having very low physical activity levels. So as you know, I'm a professional giving physical activity, promoting physical activity, and I think it's always important to monitor physical activity for physical health reasons, but this is also an argument to monitor physical activity for mental health reasons and to detect loneliness. If we are talking about monitoring apps, I need to guide you through some concepts, and these go from sensor to app. Here I show you three three examples of sensors. On the top left, you can see a PPG sensor. It has PPG signals, which will lead eventually to a heart rate calculation or to an oxygen saturation calculation. Next to that, you see our physical activity monitor, but the sensor inside, it's also here, is an accelerometer. And then below, you have a wristband that everyone can recognize. I just took a picture from the internet, which will combine the PPG and the accelerometer signal. These sensors in the device give a raw signal. On top, you can see an electrocardiogram, so you see electric signals, and then the algorithm needs to be designed. And the algorithm here adds some filters to the raw signal, and then we'll have a peak detection. And from this peak detection, you can calculate the heart rate, for example. The same is true for the accelerometer signals. On top, you can see 3 accelerometer signals from 3 axes, X, Y, and Z. And then we add some filters, and then you could do, for example, a step count. I want to bring in the elderly factor here. So the algorithms of step count as an example that you can find in commercially available devices, they are all designed on very dynamic, very active, quite young people. These are not designed for the elderly, and therefore they will not work as well in the elderly. We did a study in Maastricht using a golden standard video analysis where you can manually or visually count how many steps someone has taken. And then we let the people wear several commercially available devices. And we saw that the validity of the outcome parameters of these devices was really, really, really poor. As in really poor. So I think it is very important to be critical about the algorithms in the devices that you are using in the field. For example, if living in a very small apartment, the amount of steps that he will take is very, very low. So it is essential that you measure every step that he will take. A commercially available device could, for example, delete the first 10 steps in the pattern. But what if these first 10 steps in the pattern from the couch to the bathroom are the most important? So people wearing those devices could be demotivated to be physically active instead of being motivated. And after some weeks, these devices will be in a cupboard and they will not wear it, just like the walking cane before. Yeah, so be very critical about algorithms that you're using. So if you have agreed on the sensor that you want, if you have agreed on the algorithm that you want, you can start thinking about a user scenario. Where do I wear the sensor? How long do I wear the sensor? How do I get my feedback? How do I respond to that? And there are more than one view here. You have the participant of your pilot or the participant of your study or the client. But on the other side, you also have the researcher or the Farah-owned partner of the collaborating partner. And all aspects should be in this visualization of the scenario. If you have agreed on the scenario, we again proceed and we go to a wireframe of an app or an application. Again, this is a very neutral one. I will give you some more examples of our apps later. And I have heard people talk about intuitive use and not making it too difficult. These aspects of usability and user interface come here into play, and this has to be tested very thoroughly before you go to the designers. So if you are 100% sure this is what I want, then you bring these wireframes to your developers and you say, build me a fantastic app. There's a lot of work going preceding the actually building of the app. Here I show you our 2 physical activity monitoring apps. On the left, you see the hospital fit. It is being used in the hospital, and truth be told, it has been built mainly on the requirements phrased by clinicians, researchers, and physiotherapists. This app is measuring physical activity on the upper leg, as you have seen on the picture before, of patients who undergo, for example, hip surgery, knee surgery, and are mobilized in the hospital. It has a therapist login, so the therapist can see how much the patient is doing, how mobile or immobile someone is, and they can nudge them, like, here, watch this video, maybe you can stand up independently. And on the other side, you have the continuous use of the patient on their own mobile phone. The other app is Miss Activity. This is the one that is being used in the Dutch pilot in Pharaon. And I also always have to explain the word miss, and I think it's very essential to understand this. Miss stands here for measure is super simple, or measure it super simple. We want to know how active people are, and this is what we want to show in the app. No beeps, no blinks, no different faces, a very natural use of an app. Have I done enough today, or do I have to do more? Measure it super simple. I will go back a little bit before I answer the question. The MIST activity was designed especially for elderly and by the elderly in co-creation. So from all the concepts, so the sensor itself, the algorithm, the user scenario, the wireframe, and the app, elderly were continuously involved here. Now, the question that I got before I did the presentation was, is it to be used only by the elderly? No, it's not. The essence is that it is simple. It is not written that it's for elderly. So elderly have used it, elderly have positively evaluated it, but this app has also been used very recently in the hospital or in the rehabilitation, I must say, of people with chronic back pain, and they are quite young, and they also really liked the use of this very, very simple app. Voila, technology does work. I'm not going to show you all the aspects of the app development, but I do want to stress on some things, and I do want to tell you some stories. Yesterday, you already heard about technology readiness levels, and in apps, I think it is essential to stick to it, also in hardware design, but also in software design. So the story is this, if my slides want to adapt. You start from a concept, then you start developing, writing the scenarios, as I told you. You go to proof of concept, a prototype, a field test model, and finally maybe a product. On every step that you take on higher TRL level, there is a validation and there is a thorough testing method that is essential. I have a story here. There was a colleague of mine. She went to a sports congress, a sports symposium, and there was an app being presented, like, watch this, it is very exciting, very new, download it now and test it in a coffee break. And did it. And in the coffee break, the majority of the people was disappointed. So the app didn't work. It didn't work on all the mobile devices. So you should avoid these scenarios, especially when working with elderly. It has to go smoothly. If they experience problems in the first use of apps or whatever, they will be disappointed and they will not use it. It is very, very easy to make an app on the developer's phone that works there, like the proof of concept. It's very easy. But to make an app, it's always hard, and it takes a lot of effort and a lot of time and a lot of money. In practice, on my computer, it looks like this. So every product that we make, we put on the TRL level scale. As activity is here. It successfully went through the field pilot study, and now we are ready to bring it further. And the hospital fit app is actually here. It's a medical device used in hospital. Data are flowing to the health record, and we are truly, really proud. This is an important one. Stick to your goal. So if you are developing something, you should always be aware, what do you really want to know? What do you really want to measure? I have an example here from the internet. This is Word with a lot of features, a lot of functions, a lot of beeps, a lot of blinks. Is it useful? No, it is not useful. People will not work with that. It's the same with physical activity monitoring. The questions that I always get, can it also measure sleep? Can it also measure heart rate? Can it also measure stairs? Can it also measure running? And so forth and so forth. No, we want to know physical activity. We want to motivate people and we want to make sure that it's easy to use. So my credo is, yeah, keep it simple. The things that you put in there have to be 100% validated and they need to work. And I'd rather put one parameter in there compared to 10 that I'm not sure about if they will work. Also in functions, in scrolling through the app, keep it simple. Only put in what you want in. In reality, it goes like this. So you have a goal, I want to measure physical activity, and then the product that you are developing together. Ideally, you go to your target audience and you go with them in co-creation and you do the usability research and you have your own goal and it will work. But in practice, the researchers come in, clinicians come in, and they all want to have all different features. They are always nice to have, always. Like, I know an app that can do this, or I have an app that can do that. Could you also do that? There are other stakeholders, for example, project partners. And then finally, there are the engineers. Well, this is good and well, but I think it would look better like that. Or I think so they also have their opinion, and it could go very easily, very quickly. So keep your goal in mind. This is an example of a co-creation of the sensor that we are using. So the goal was to display progress to goal on the sensor itself. So you don't need to open your mobile phone all the time, but the sensor could also give progress to goal. So we asked the elderly people, how would you like to have this displayed? And then again, you have different possibilities, but maybe it is not so easy to amend electronic to be visible. Luckily for us, they chose and but just my message is here to say it can go away from your goal very quickly, and it can be very hard to implement sometimes. Here is I give you some examples on user scenario. For example, you want to measure heart rate in people. Yeah, there are very, very different ways of doing that. I showed two. So 3 are with a belt or a band on the chest, and another one is with leads. So one measures better than the other. I let you choose which one, but both are not as easy to wear by participants. So I cannot imagine people wearing a lead ECG for 30 days at home, for example. So this has to be implemented in your user scenario. Is it feasible? Is it acceptable? Will people do what you want? Then the physical activity monitoring. People like to, no, I'm going to change my statement. Many people ask for wristbands for physical activity monitoring. And I show you two on the left. So you have this male with a black wristband and watching the app. And then in the middle, you have this elderly woman. We have performed some interviews with elderly about wristbands, and I don't know this elderly lady, but I can imagine that she tells me, you know, want to wear a black wristband. I have a watch that is in my family for so many years. I like it more. I can relate to that. I'm not as her, but I also like to wear a watch instead of a wristband. So in the user scenario, be very clear what you want to do, and please try the consequences. For example, your project can fail if they say, I don't want people to see that I'm being monitored. And that is reality. So this is what happened in the wristband on the right that you can see here. This was a monitor that was especially designed to measure tremor in people with Parkinson. So here they had to wear a sensor, especially to the right wrist and one to the left wrist, and they should not switch it. They should take it off at night. They should be able to charge it, so they cannot take it out of the pocket. So the pocket had to be designed so that they can charge it very easily. They should see whether the battery has to be charged, and so forth and so forth. These are all aspects that need to be in your user scenario. Also there we had indeed the comment like, I don't want people to see that I'm being monitored. And that is reality. This is an example of a daily use of the MIS activity. And I have a sensor here. It has a new clip. So it needs to go into the pocket and very deeply into the pocket, because if you move your leg up to sit, it should change orientation. This has to be explained also to people, and it has to be very developers how the sensor is being worn. Here you can also see before and how we visualize the feedback on the sensor, and then you can also see here how the battery status is being displayed. The more clear this is, the easier the development is for the engineers. I know you cannot read this, I'm so sorry. You have to believe me, but this is the wireframe example from the Hospital Fit app. And on top you have the therapist view, and on the bottom you have the patient view. And this has to be, as I said, this has to be tested on paper, but also with paid therapists before you can go to developers. And it's quite a lot of work. And then relating to Pharaon, of course, you have a data flow. And yeah, this is a big exercise. So to design an app for the elderly was difficult enough, but this is only this picture. It's only that what they use, it's only that that works, and it's only that what will make the effect. But on the back side, I want those data to be securely stored. Yeah, ideally, if there are researchers or other people working with the data, you need to store them safely. And then with Pharaon, for example, you may want to share this data. And it can be that you add these parameters to the Internet of Things at home, as we have seen already in the movies. Or it could be that you collaborate with partners, research partners, Pharaon partners, whatever. And then there is a big question of interoperability. And this question was also asked for the presentation. What about interoperability of physical activity monitoring? What I'm going to say now is a very, very personal opinion. I think that people do not even agree on the common data that's being used on the outcome parameters. For example, active minutes per day or steps per day. These are not even defined yet. So also the sharing of the data and the connecting with other devices or other systems, they are not as good as they should be. And there's a lot of work to do there. You have big players in the field, for example, Fitbit or Garmin or other, they may publish their API publicly and say these are the parameters that you can get from our device. But the interoperability, there's a lot of work and a lot of projects to do there still. Okay, I will conclude now. I think not only for physical health, but also in assessing loneliness it is very important to measure physical activity in elderly. And if you're going to build a monitoring for that, please pay attention to the requirements of the elderly in all aspects, like sensor, algorithm, and the user scenario. Also, make sure that your development and testing method is valid and is really robust, so that your success chance is much higher afterwards. There was one question that I was not able to implement in my presentation yet. So there's specialized digital tools for people who need care are quite expensive. What is being done to make them more accessible and economical? I do relate to the question, and I think it's very true. In physical activity monitoring and the things that we are doing now, I want you to keep in mind this picture that I showed. So it is very expensive to go to this product that is tested and is being developed together with the right people. But at the end, there always needs to be an upscaling partner. And there you can, for example, make the production of the sensor much cheaper. You can outsource that. And there could be business models together with care institutes or whatever. But it is expensive, and I do not have a clear solution on that, except to find a good partner who can make the sensors more cheap. Okay, I thank you so much. I hope I still have time to answer some of your questions.
Thank you very much. And you've been able to make us pay attention on many useful tools and devices, and you have focused the importance of users' real needs, moreover the functioning of technology tools. Thank you very much. I hope see you in November in next meeting of Faron project. And now we stop till next conference during 5 minutes.